Hey, if you have high blood pressure, you really want to pay attention to this next segment, especially if you're taking a diuretic. Now, there are a number of different types of diuretics, but three of the main types of diuretics, you might recognize the names. One is Lasix, another is the drug called furosemide, and then there's another class or type of diuretic called hydrochlorothiazide. And so these diuretics are medicines that are generally prescribed to treat people's high blood pressure, and the whole premise is that they increase urinary output. They reduce the quantity of water in your body. So by default, they're basically dehydrating you in an effort to lower your blood pressure. Now, why would doctors want to lower blood pressure? Because high blood pressure is one of the risk factors that increase the possibility that you could have a stroke or a heart attack. And so anytime somebody's blood pressure is high, again, the standard of care in this country is diuretics, one of the first arsenals out of the drug toolbox to be used to reduce volume of water content of the blood, which by default reduces blood pressure. Now, one of the side effects to using diuretics is as we lose that water, we also lose nutrients. Vitamins, minerals are also lost through the urine. Now, I'm going to put a research study up on the board for you, and what you can see here, this was a review published in the journal Nutrition Reviews. And so based on what they're saying here, you can read here, despite modern pharmacologic agents in the therapy of heart failure, the prevalence of heart failure is increasing worldwide. Now, I'm going to pause there. Despite using drugs to treat these risks, the prevalence of the diseases continue to increase, right? So what does that tell us empirically? It means that even though we're using all these drugs to reduce risk, the diseases continue to grow as time goes on. So that what that tells us empirically is the drugs are not all that effective at really reducing risk. Now, there are doctors that would argue with the statement that I just made, but if the drugs worked, we wouldn't see as much of these problems, but the issues are we are seeing more of these problems despite the drugs. Now, these authors go on to say, in the vitamin B1 deficiency disease beriberi, okay, cardiac symptoms may represent the central feature. 2 new studies confirm that all diuretics lead to increased urinary thiamine. What does that mean? Let's make sense of that. All diuretics cause the increased excretion of the very important B vitamin thiamine, which is vitamin B1. Now, beriberi, which is a disease caused by vitamin B1 deficiency, looks like, in a clinic, symptomatically looks like congestive heart failure and high blood pressure. So think about this for a minute. You have high blood pressure. Your doctor prescribes you a diuretic. The diuretic causes vitamin B1 deficiency. Vitamin B1 deficiency causes congestive heart failure and causes your blood pressure to go up. How are you winning in that scenario? How many of you taking a diuretic have actually had a doctor say, because you're on this diuretic, we need to monitor your vitamin B1 levels to ensure that we're not creating a new problem that can look like the very problem we're trying to treat? Raise your hand. Comment below if your doctor has put you on a diuretic and offered to test your vitamin B1. And also comment below if you're on a diuretic and your doctor hasn't. I'd like to know. I'd like to hear from you. Now, I'm going to show you this other research study on the long-term diuretic therapy use in patients. And so in this particular study, they were measuring the homocysteine levels. Now, you probably heard me talk about homocysteine before. It is a chemical that when your body makes too much of it can increase your risk for heart disease. It's an independent risk factor for heart attacks, for stroke, for diabetes, for cancer, and for osteoporosis. So not a chemical we want to have floating around in high quantities in our blood. Now, the only way to lower homocysteine is through B vitamins. And one of the most important B vitamins that helps lower homocysteine and keep it in balance is folate. And what the authors of this research study found is that chronic diuretic use is associated with a significant increase in elevations in homocysteine concentration, as well as a significant decrease in the quantity of folate inside of red blood cells. In essence, people on long-term diuretic therapies have a greater risk of developing folate deficiency and elevations in their homocysteine levels. Again, homocysteine causing an increased risk for heart disease. And the only way to really get it down is through B vitamins, and folate is one of the most important B vitamins to get it down. So now that's 2 B vitamins from 2 research studies that we know that diuretics can cause deficiencies of, and those deficiencies can increase your risk of developing the very same types of disease that your doctors are trying to treat with the medications. So, what's the takeaway here? If you're on diuretics, talk to your doctor about testing your B vitamin levels. You might as well ask him to test your mineral levels while he's at it, because these diuretics also could deplete magnesium and calcium and potassium and other very critical electrolytes that help your body regulate blood pressure. And so if you're on these drugs, your nutrient status should be being monitored, because these drugs damage your nutrient status and induce the very disease the drugs are targeted at treating.